Hello, I'm William from StimTech Medical, and we're the New Zealand distributors for the Alpha-Stim medical devices. Now, in the beginning, it made sense to engage the services of a medical research analyst to check the Alpha-Stim out for us. Now, I must say, we were really impressed, and Lucy agreed to be interviewed on camera. But before we play the interview, the Alpha-Stim is a medical device used by medical organisations around the world, with hundreds of thousands of patients reporting remarkable results, particularly in the area of depression, insomnia, anxiety, and also for the treating of chronic pain. This interview is 6 minutes long, so thank you for watching.
I'm a research analyst, and I was engaged by Brylan to have a look at the Alpha-Stim and to assess it for its usability at home in a home setting, and also to do a literature review of the scientific research that's been done on it for its effectiveness. Initially, what really impressed me about the Alpha-Stim was the extent of the rigorous research that had been done into it and the findings of that research. The second thing that impressed me at the beginning, when I was first given one to use, was how easy it is to use in a real-world setting with just ordinary, untrained individuals using it at home. At the conclusion of the research review that I had done and looking at it over a period of months, the impressive thing that I'm left thinking is how wonderful it is to have a device that actually bolsters a patient's ability to maintain their well-being in the long term. This is because with repeated use, the Alpha-Stim habituates the body to the healthy, normal electrical wave pattern. And the result of that is that the patient develops an element of resistance to relapse into those conditions in the long term, which means they're far less likely to suffer from chronic pain or depression or anxiety in the future. It's certainly not a quackery device. This is now a fully integrated medical treatment that is used now as a standard treatment. In the US, for their military particularly, they have really adopted it with open arms, and it's now also a standard treatment within the United Kingdom's National Health Service, as well as many other services around the world have adopted it. They're registered as a medical device in many countries, and in order to be accepted by insurance companies and sort of health providing services, any medical device or treatment needs to pass very strict levels of independent clinical assessment. So there are independent companies that do carry out this medical research, and they're very rigorous, and which means they use a lot of patients. They use controlled studies to ensure that there's no placebo effect, and they also have to use them within a standard clinical environment. And that's important because it means that the device is being used by ordinary people, not in a laboratory setting with specially trained technicians, but by ordinary practicing clinicians in their normal practice and within an NHS setting, which has normal patients with all the variability that involves. And that means that when we compare the results of those treatments, we know that we're talking about real-world environments. And the Alpha-Stim performed extremely well under those conditions. So it was independently tested, it was tested using very rigorous methods, and it was tested in real-world environments with a huge number of patients, and performed extremely well. By performed extremely well, I mean that it actually did a little better than the alternative drug treatments and cognitive behavioural therapy for generalised anxiety disorder in particular, and was so impressive to the clinicians who used it that they adopted it very quickly once it had passed its certification. And those clinicians are now using it in conjunction with these other therapies because the combination is even more impressive. There are lots of medical devices that use electrical impulses of some kind or electrical waves of some kind in a therapeutic context. The TENS machine, for example, I had one myself, and I was given that to treat chronic nerve pain. It's a much stronger impulse, and the way it works is it overwhelms the nerves with the electrical impulse and drowns out the pain. This Alpha-Stim device works completely differently in that instead of trying to overwhelm the nerves with an electrical signal, it simply tries to balance it. So we're talking about a very tiny electrical signal, an electrical current that is so small but very precise in its waveform that it is matched to the natural, normal electrical current that occurs within the body. And what we're doing is normalizing it back to what it should be after that body's electrical signal has been disrupted and altered. And it's that disruption and it's that alteration of the natural signal that is causing the problem. And instead of overwhelming it or blasting it with something much, much stronger, we're simply using a much gentler and much more targeted and much more effective, as it turns out, tiny electrical signal that is very carefully matched to the healthy, normal signals that would be travelling through the cells and the nervous system in a normal, healthy person. And that balances it, brings you back to where you should be.